Let's begin our study of the lower extremity bones by first looking at the femur, which is the thigh bone. First, we have the head, the neck, the greater trochanter, the lesser trochanter. If we go to the posterior view, we can see up here is the gluteal tuberosity, and that brings us down to this linea aspera. If we flip back over to the anterior view, we know that the head is always medial, so that tells us that this is the medial condyle. We have the medial epicondyle. Epi means above, so above the condyle. If we have a medial, that usually means we have a lateral, so lateral condyle, lateral epicondyle. This would be the patellar groove. And on the posterior side, we have the intercondylar fossa. So it's in between the condyles, intercondylar, and it's a fossa. All right, next let's take a look at the tibia, or the shin bone. I always start with the medial malleolus, so I look for this hook right here, which tells me that this is the medial side of the bone. So if this is the medial malleolus, that tells me that this right here is the medial condyle. And if there's a medial condyle, that usually means that there's a lateral condyle as well. In between the two condyles, we have the intercondylar eminence. This bump right here is the tibial tuberosity, which is the attachment site for many of the quadriceps muscles. Okay, and that's it for the tibia. Next we have the fibula, which I'm going to flip around this way. So this flatter top is the head, which I think of flat head, like a flathead screwdriver. And then this side is actually pointing down a little bit more. That's going to be the lateral malleolus. Next we have the patella. Okay, all I need to know is just the name of the patella. And last we have the foot and ankle. This, looking at the top of the foot, would be the dorsal view, and looking at the bottom of the foot would be the plantar view. So these bones collectively would be called the tarsal bones. Now for the purposes of our class, you just need to know two in particular, which would be number one, the calcaneus, which makes up the heel bone, and two, the talus, which articulates with the tibia and fibula to form the ankle joint. These would be the metatarsals, and these bones would be called the phalanges. Now we're always starting from the big toe, and we're naming that as number one. And then we go number two, number three, number four, number five. So this would be metatarsal 1, metatarsal 2, metatarsal 3, metatarsal 4, metatarsal 5. These are the phalanges. If we want to identify one in particular, we would say phalanx. So this is the proximal row of phalanges. This is the middle row of phalanges. Notice that the big toe does not have a middle phalanx. And then this is the distal row of phalanges. So if I wanted to name one independently, I would say this is distal phalanx 1, proximal phalanx 2, middle phalanx 3, metatarsal 4, and we could just pick another random one here. We could say distal phalanx 5. So that's it for the lower extremity bones.